Hello everybody, I am Dr. T.S. Roy, ex-professor and head, Department of Anatomy, All India Institute of Medical Sciences. Today I will be discussing about the arterial supply of the brain. The brain is about 2% of the body weight and it consumes nearly 20% of the oxygen. Unconsciousness occurred due to cessation of blood supply within 10 seconds. That is why arterial supply of the brain is very important topic. The specific learning objectives are: identify the arteries supplying the brain, understand the arterial anastomosis at the base of the brain, identify the functional areas supplied by various arteries, and understand the effects of occlusion of these arteries. The brain is supplied by two sets of arteries, the internal carotid artery and the vertebral artery. The internal carotid artery is a branch of the common carotid artery and it terminates as anterior cerebral and the middle cerebral artery. The vertebral artery is a branch of the subclavian artery and it joins to form the basilar artery which terminates as posterior cerebral artery. The internal carotid artery enters the cranial cavity through a foramen in the temporal bone, the carotid foramen. After entering the cranial cavity, it lies on the foramen lacerum which is covered by cartilage. Then it enters the cavernous sinus. It pierces the roof of the cavernous sinus near the anterior crinoid process and enters the subarachnoid space. The vertebral artery lies in the foramen transversorium of the upper 6 cervical vertebra. At the lamina of the first cervical vertebra, it bends backwards, then it pierces the posterior atlanto-occipital membrane and it enters the cranial cavity through foramen magnum. It lies in the subarachnoid space in the interpeduncular fossa. Branching pattern of the cerebral arteries. Vertebral artery and the internal carotid artery, after entering the cranial cavity, ramify on the cortex of the brain. It gives short branches which supplies the different functional areas of the brain, and it gives long branches which supplies the nuclei and the fibers of the brain. After entering the cranial cavity, the internal carotid artery gives hypophyseal branch and laterally it lies in contact with the third, fourth and sixth cranial nerve and also with the branches of the fifth cranial nerve. This is a common site for arterial aneurysm and may give rise to pressure symptoms to these ocular motor nerves which may give rise to strabismus. The branches of the cranial part of the internal carotid are hypophyseal artery, ophthalmic artery, anterior choroidal artery, posterior communicating artery, and the terminal branches are anterior and the middle cerebral artery. The intercranial part of the vertebral artery, after entering the cranial cavity, the vertebral artery of both the sides join in front of the pons and it forms the basilar artery. The basilar artery terminates as posterior cerebral artery. The fourth part of the vertebral artery gives rise to anterior spinal artery which joins to form a single anterior spinal artery which lies in the anterior median fissure of the spinal cord. The other branches of the fourth part of the vertebral artery are medullary arteries, posterior inferior cerebellar arteries. The medullary arteries are very important because it supplies the vital cranial nerve nuclei. Anastomosis among the arteries of the brain. The branches of the internal carotid and the vertebral arteries join to form the arterial circle of Willis. It lies at the base of the brain in the interpeduncular fossa. The circle of Willis is formed by the branches of the internal carotid and the vertebral arteries. Anteriorly, it is formed by the anterior communicating artery which joins the two anterior cerebral arteries. Laterally, it is formed by the internal carotid artery. Posteriorly, it is formed by the posterior cerebral artery, and posterolaterally, it is formed by the posterior communicating artery. It gives perforating branches which enters inside the brain and supplies the important structures like internal capsule and the different nucleus of the brain. Although it is a physical anastomosis, little mixing of blood occurs between the two sides. If there is a blockage of any part of the artery, then blood from the unoccluded side comes up to the occlusion from the opposite side. Sites of occlusion by thrombus and aneurysm of vessels in the circle of Willis. The bifurcation point of the arteries becomes narrow due to atherosclerosis with aging, and it is a common site for thrombus formation, and emboli obstructs these areas and it can give rise to arterial occlusion. The branches of the basilar artery are posterior cerebral artery, pontine arteries, labyrinthine arteries. The basilar artery lies in the basilar groove in the pons, and it terminates as posterior cerebral artery. Branches of the basilar artery. The pontine branches of the basilar artery are very important, and there are three types of branches from these arteries: the perpendicular arteries, short circumferential arteries, and long circumferential arteries. The perpendicular and short circumferential arteries supplies the ascending and descending tracts, the reticular formation, and the major cranial nerve nuclei in the pons. The medullary branches of the fourth part of the vertebral artery also gives branches which supplies these ascending and descending tracts and most of the vital respiratory and cardiovascular centers. Occlusion of the basilar artery or the pontine artery may lead to coma and death. The anterior cerebral artery, after its origin from the internal carotid artery, lies in the fissure between the two cerebral hemispheres, and it comes on the medial surface of the brain. It gives orbital, frontal, callosomarginal, pericallosal, and some smaller branches which supplies the medial surface, about 2/3 of the medial surface of the cerebral hemisphere. It supplies the paracentral lobule. Anterior cerebral artery occlusion. The anterior cerebral artery supplies the paracentral lobule, and it is the extension of the sensory and motor cortex from the lateral surface of the brain. Here lies the center for micturition and center for defecation. So, blockage of the anterior cerebral artery may give rise to micturition and defecation difficulty, motor and sensory loss of the contralateral lower limb and the perineum, also motor and sensory loss of the face, tongue and upper limb if the fibers of these areas passes near the genu of the internal capsule. The middle cerebral artery, after taking origin from the internal carotid artery, lies in the sylvian fissure. It gives cortical branches. The branches are frontal polar artery, prefrontal artery, precentral artery, central artery, posterior central artery, and from the inferior surface of the middle central artery, branches are temporal artery, temporo-occipital artery. The middle cerebral artery supplies the primary motor area, somatosensory area or area 312, frontal eye field area, and the motor speech area. Occlusion of the middle cerebral artery give rise to motor and sensory deficit of the face, upper limb, upper part of the body, and aphasia. Hemiplegia of the lower limb occurs due to occlusion of the central branches that supplies the internal capsule. There may be contralateral hemianopia because the blockage of supply of the optic tract. The posterior cerebral artery, after taking origin from the basilar artery, lies in the superior surface of the pons, then it comes towards the medial surface of the occipital lobe. Then it gives branches to the occipital lobe. It lies in the parieto-occipital sulcus and calcarine sulcus, and it gives branches parieto-occipital, calcarine, the occipital branch, and the most of the medial part of the occipital lobe and the inferior surface of the temporal lobe are supplied by the branches of the posterior cerebral artery. Occlusion of the posterior cerebral artery give rise to homonymous hemianopsia of the opposite side or visual field defect, loss of memory as it supplies the part of the hippocampus, and alexia because the fibers connecting the visual area with the speech area are affected. Arterial supply of the base of the brain. In the medial part, the base of the brain is supplied by the anterior cerebral artery including the frontal pole. The middle cerebral artery supplies the temporal pole and part of the inferior surface of the temporal lobe. The posterior cerebral artery supplies the occipital pole and more or less half of the inferior surface of the brain. So, in summary, arterial supply of the brain. The anterior cerebral artery supplies the medial surface of the brain excluding the occipital lobe, and also it supplies the part of the lateral surface of the brain towards the superior border. The middle cerebral artery supplies most of the lateral surface of the brain excluding the upper border and the occipital pole and slightly towards the inferior surface of the temporal lobe. The posterior cerebral artery supplies the occipital lobe and also part of the inferior surface of the temporal lobe. The inferior surface is supplied by all three arteries, medially by the anterior cerebral artery, laterally towards the orbital surface, and part of the temporal lobe it is supplied by the middle cerebral artery. The major part of the temporal lobe is supplied by the posterior cerebral artery. So, the take home message are: the brain is supplied by the cortical and central branches of the internal carotid and the vertebral arteries. Cortical branches supplies the functional areas such as motor and sensory areas, whereas the central branches supplies the nuclei and white matter. Blockage of the basilar artery is dangerous as it supplies the vital centers like cardiac and respiratory centers. You are supposed to read in details about this arterial supply of the brain from Bart's nervous system, Petit's textbook of neuroanatomy, and Fitzgerald's clinical neuroanatomy. Thank you.